This webinar includes educational footage of real-life dry needling demonstrations on patients. Some scenes may contain partial views of patient anatomy, including the gluteal region. Viewer discretion is advised. This video is intended for licensed chiropractic professionals and students and is to be used for educational purposes only. All procedures shown were performed with patient consent in a controlled clinical setting.
Hello and welcome everyone, and thank you for joining our dry needling webinar today. My name is Sawyer Barkas. I am a product marketing specialist with ChiroTouch, and I'm so excited to be here today. I want to extend a warm welcome to Dr. Wiegand, who's a second-generation DC. Dr. Wiegand is the author of the Physiotherapy Guidelines published by the ICA and numerous other peer-reviewed and professional journal publications. Dr. Wiegand is currently in full-time practice in a multidisciplinary pain management clinic where he utilizes traditional chiropractic combined with rehabilitation, acupuncture, and dry needling to treat post-op, chronic pain, and personal injury patients. I also want to introduce someone very special, Anna Picota. Anna is an experienced senior sales executive with a super strong background in the chiropractic software industry. With over 15 years of experience, Anna specializes in understanding the unique needs of chiropractic offices and provides tailored software solutions that drive efficiency and growth. With that being said, I'll go ahead and pass things over to Dr. Wiegand now.
Hey everyone, I want to thank Sawyer and everyone at ChiroTouch. Really, thank you so much for inviting me to come talk to you guys today. I'm very passionate about this and about dry needling and bringing it to the chiropractic profession. And I really appreciate this opportunity, but let's get to work because I know a lot of you are on your lunch break and I really want to get to this material. Just super excited about it. This is actually our first webinar at ChiroNeedle. And again, I just want to thank ChiroTouch for bringing us on. If you have any questions and you'd like to contact me or my team over here, it's at info@chironeedle.com. I'm happy to answer any of your questions, even if you're already a dry needler and you just have more questions or like to have some information, or if you'd like to add it to your practice. So today, what we're going to be talking about is adding dry needling to the chiropractic practice. What is it? What does that necessarily look like? I mean, most of the world thinks of dry needling as a physical therapy technique, but it's in a lot of states, it's being added to chiropractic scopes of practice. And they have unique, there's unique utilization. Our patient demographic is different and how we practice is different. And so the way we dry needle should also be different. A little background on myself shortly. I went to University of Arizona. I have my degree in physiological science. Went to the late, great Palmer West. Got certified in spinal trauma, spending way too much time with Dan Murphy. I love him. If you ever get a chance to be in any of his classes, highly recommend it. While doing dry needling, so many of my patients wanted to know if I did acupuncture, and the answer was no. And I really didn't know much about acupuncture until I went and got certified in it. So now I do both. And I really enjoy mixing them together. And no, they're not the same. They really do complement each other nicely. Also, I got most of my training in dry needling with Sue Falsone. She was the first female trainer in MLB history for the Dodgers. And I believe I was the first person to get their SFDN designation and definitely the first chiropractor. So that's a little background on me. Adding things like dry needling is controversial in chiropractic. There's people who don't believe it's necessarily within our tradition, and I just want to say I'm very traditionally at heart a chiropractor. My father was a chiropractor. I love his business card from back in the 70s. That haircut is fantastic. That's me adjusting him at the Masters. So I'm steeped in chiropractic. I love chiropractic, and I think dry needling is really complementary to the profession. But how did I get in here? Well, I was doing deadlifts, decided to blow out my L4. For those of you looking at my reading right, you have a 13 millimeter disc extrusion that went into my central canal there. That felt really good. And in actuality, of course, it didn't. But I had to go to work that day, and my glute was seized up, and I didn't know what I was going to do. So I went to the physical therapy office on my block, and I'd been sending them all my extremities and things I just didn't feel equipped to deal with. And this physical therapist, fresh out of school, pulled out a 100 millimeter needle and put it right in my glute med, and then proceeded to electrocute me with a point stimulator. I was shocked that I didn't even know what he was doing, didn't have any awareness at all. And then I was even more surprised at how much better I felt instantaneously. Now, obviously, it didn't fix the disc herniation, but allowed me to go to work. And those of us in chiropractic know that when your body's injured and you have to go to work in chiropractic, a lot of us end up injuring ourselves. It's a scary time. So I was very relieved, but I was also a little frustrated with my profession that I didn't know anything about this technique. So I went and spent the next 4 years diving headfirst into the PT world, learning how to do dry needling. So here's one of the classes I was in. And this was about, let's say, probably 7 years ago, 8 years ago. It's me in the middle with a bunch of physical therapists. So I spent a lot of time with them, learning everything I could. And they, we were really passionate about dry needling. And there's a lot of physical therapists taking dry needling classes. I assume about 200 a day are getting certified. And I really think chiropractic needs to focus more and get more engaged in the dry needling community. Was great about dry needling is it allowed me to treat a lot more conditions. It really opened up my practice and the potential that I had as a practitioner, and also how effectively I could treat all kinds of different things. And we'll talk about some of those later. Not only that, but it made practice a lot more fun. I went from one of those kind of traditional chiropractic offices that are pretty passive, meaning things are happening to the patient, whether it's stim or adjusting or rubbing or zapping or lasering, or it's all passive. People are laying on tables, having things done to them. It turned my office into an active care practice where people were moving and just focusing more on function. And that really expanded, what I was able to do as a chiropractor. So why am I here today? Well, one, there needs to be a standard. We need to have standards in our profession, and nothing can be more true in dry needling because it does have inherent danger with it. It is a little more risky than anything else we do, while being really, really safe, especially relative to anything else for treating most of these conditions. So I want to set a standard. I want us to be really good at dry needling. I want us to be safe dry needlers and effective dry needlers. Also, needling techniques just changed what I was able to do in my office. I was able to address so many more in different kinds of conditions. And one of the most rewarding things is how it opened up my ability to deal with people with chronic pain or neurological pain syndromes. The frustrating patients that their pain doesn't come or go with any rhyme or reason. A pain generator is hard to find. These are the people that, are super happy one day and then not the next day. They're the ones we look at on the schedule and go, oh, this one again. Dry needling really helped me be able to effectively manage these people and understand them better. And also, you're a doctor. Utilizing your full education should be something that's really important. And dry needling allows us to do that. It allows us to really think of the body in a three-dimensional space. It really utilizes your education as a doctor and gets you, I think, and did for me, was get me out of the rut of adjusting, stimming, rubbing, stretching, over and over and over again. It really made me a lot more targeted in what I was treating and how I was able to manage patients. So today we're going to be talking about what is dry needling, how does it work, how is it different than acupuncture, because there's a lot of debates about whether it's the same or not, and how it should be integrated in practice. And we're going to go through these as quickly as possible. I'm sorry if I'm talking very fast. I want to get to this information. I'm so excited to be sharing it with all of you. All right, so let's talk about other dry needling or different needling techniques. Acupuncture. Well, acupuncture is pre-science, okay? So acupuncture came around before we had science. So they described things in terms of philosophy, in terms of the ideas of energy, yin and yang, qi or sha, the elements. That's kind of how they did their diagnosis. That's how they believe the body worked. The 5 elements theory of qi. These are all things that I suggest everyone go learn. I think if you can do acupuncture in your state, in your practice scope, you should go do it. It helps a lot of people, especially with stress and anxiety or just general pain syndromes, but it is not dry needling. Now, there is Western medical acupuncture, which is sort of in the middle. But again, its point is not necessarily the targeting of meridians, but rather the balancing of the autonomic nervous system, not unlike traditional chiropractic for general health problems. But dry needling, where did dry needling come from? It wasn't simply that physical therapists and chiropractors decided they wanted to do acupuncture and needed a workaround. Contrary to popular belief in the acupuncture community, dry needling was born out of Travell and Simmons doing their trigger point work where they were doing trigger point injections. But in trying to find the placebo effect of the needle itself, and they would inject just saline solution and then eventually a dry needle, a needle with nothing in it, to see how effective that was without any kind of medication. Well, to their surprise, The needle itself is highly effective. When just used, just the needle, the trigger point pain would reduce significantly, and they mention that in their work. So certain studies or certain publications have tried to define dry needling as a trigger point technique. Well, it's much more than that. We can target trigger points, ligaments, tendons, bruises, even nerves. So it's much more than that. But if you try to define dry needling as a trigger point technique and acupuncture in the context of a acupoint or ashi point technique, it doesn't really hold water. And the reason being is that 93.3% of where we find common trigger points overlap where we also have the acupuncture points. So really, they're the same name, different name for the same phenomenon. So it's not really, that isn't really a distinguishing difference. The difference between dry needling and acupuncture really is the why and the how, meaning in dry needling, we're targeting actual body parts. I'm putting needles all the way down through paraspinal muscles, into multifidi, and even into facet or lamina periosteum. So it's about targeted tissue rather than targeting points or neurological acupoints. So in all, there's really 4 different types of needling techniques. There's traditional acupuncture, which is based on energy, medical acupuncture, which is based on the autonomic nervous system largely, deep acupuncture, which is really acupuncture's attempt to get more into dry needling by defining it as deep acupuncture. But really, dry needling in and of itself is the only thing that only targets neuromuscular conditions and targets the tissues themselves. So this is a slide I put together kind of where it puts all these needling techniques into context. Now, over the years, now within the database, the nice thing about needling techniques is that it's not just something within chiropractic. Much of the things we do in chiropractic, only people in chiropractic do. And it's nice to have something that is effective, but also recognized by the general healthcare community. And if you look in PubMed, you can find that acupuncture has 41,000 plus citations. Dry needling, actually, I just searched this morning, is up to 1,300. And now deep acupuncture studies are being published as well. All of this body information is at your disposal to use and apply to your patients, as long as it's obviously within your scope and you have the training. But there's a lot of evidence out there and a lot of data on a lot of conditions on how to effectively treat a lot of things that you may not have been able to or done as well before. So that's the other nice thing about needling techniques, is you have a big recipe book to pull from. And the evidence for dry needling, again, it's growing exponentially. We have within a year, there was a 50% increase in the number of studies published. And again, I looked it up today, and we're about 1,250 citations involving dry needling. So there's so much evidence that it's really easy, if you have a condition that comes in your office, to see what studies have been published, how they applied dry needling and what the effects were, and how they integrated it with other physiotherapy techniques. So that was an epic fail on the animation of the arrow. But what I want to point out in this slide is that the people who are seeing acupuncture practitioners, 38% of them, or the vast majority of it compared to anything else, are going there for musculoskeletal conditions. Now, who best to treat musculoskeletal pain conditions really than the chiropractic community? This is our wheelhouse, and this is our home, and these people are being helped using needling techniques, and I think we are the most qualified to do it. Now, in the United States, there are some states where dry needling is allowed for PTs, some for chiropractors, some absolutely not, it's prohibited, and other ones, they just don't know. So this is a map showing in the blue where all the states where PTs have the right to do dry needling. The red is where they don't, and usually in those states, neither do chiropractors. And the gray is they have no opinion. Chiropractic, now this is an ever-changing landscape. Florida just changed their laws to include dry needling. Texas doesn't have any specific number of hours, I don't believe, to allow dry needling, but you do have to have some training. Arizona is 24 hours. Nevada is 50 hours. So it's all different from state to state. But over time, as they get included in the practice acts, it's really important that we have standards on safety and application of dry needling because of the inherent risk of the procedure. We all know what happens if a chiropractor gets in trouble injuring somebody. It doesn't matter that it could be anybody. If it's a chiropractor, they're going to use that to attack our profession. So we have to be extra careful. So here's a quote from an article about dry needling just in general. It's a lit review, and they couldn't have summed it up more simply, maybe using better words, but they say it's minimally invasive. Well, relative to what else you would be doing, that's true. If you think about the options to someone with musculoskeletal pain, there's obviously chiropractic physiotherapy, but then on the other end of the spectrum, you have injections, you have cortisone injections, Botox injections, trigger point injections. These things carry inherently more risk. So relatively, it's minimally invasive. Now, cheap, I would have preferred the word inexpensive, and easy to learn. It really is. And the reason it's easy to learn because we have the most amount of education than any other profession when it comes to musculoskeletal conditions and anatomy. And that's the most important part when it comes to needling anyone safely is knowing the anatomy. Every study or case study that is published about an injury that occurs from dry needling, every single one of them say the same thing. If the practitioner simply had known their anatomy better, this wouldn't have happened. In trigger point injections, I work in pain management. We do injections with pain management specialists all day. So trigger point injections is something we do regularly. And I've heard, watching the nurse practitioners be trained in this technique, the anesthesiologists tell them, look, the needle's doing all the work. The medication isn't really adding any therapeutic benefit, but we do it anyway because that's the code. You have to inject some sort of Marcaine or Bupivacaine or something like that, lidocaine into the injection to make it an injection. Otherwise, it's just needling. So in this study, they found in a systemic review that, look, the needles without the medication, they get the same results. Here's another one, a greater trochanteric pain syndrome study, where they compared dry needling to corticosteroid injections and found that the results were similar. Well, if you had to choose between a dry needle and a corticosteroid injection, and you knew the outcome was going to be the same, which would you choose? Obviously, for the patient, one carries significantly less risk. One is definitely has less pain associated with it, and the cost of a needle is about 10 cents to 25 cents, and a corticosteroid injection, can cost upwards of $15,000, especially if you're in the personal injury space. So not only that, but pain management specialists can only do injections. They can't do, immediately after an injection. The nicest thing, what I would love to be able to do with our patients in pain management is take them directly into rehab immediately, because it's the best they're going to feel. Once they start feeling good, you want to get them moving right away. So really, by adding dry needling to your repertoire, you're almost doing pain management and then immediately allowing them to get into some sort of therapy. And as a chiropractor, being able to adjust, you're almost a combination of a pain management specialist, a PT, and a chiropractor all in one. And if that's the way we practice and that's how we address the pain community, I think no one could possibly beat us. Another study comparing dry needling to cortisone, Botox, PRP. Again, these things are wildly expensive, carry significantly more risk, but dry needling has the same, if not better, long-term outcomes. Okay, so this is a study where they looked at superficial versus deep needling. Which is better? Does it really produce better outcomes if the needle goes deeper? And the answer is yes, it's better at all times. Now, why is that? Well, because dose matters. What I mean by dose, I mean mechanoreception. Okay, you add more mechanoreception to the mix, you get more enkephalin production at the dorsal horn, more gating, and you're going to get more and better pain control. Because if you're using superficial needling, as in the acupuncture, yes, you're going to be stimulating the Merkel discs, the Meissner corpuscles, the Ruffini's, the Pixinians, all those in the dermis, but you're not getting down to the muscle spindles, and that's where the real body drugs are made. Because if you can increase the stimulation of the mechanoreceptors deep down in the meat and the muscle with the extrafusal fibers, you're going to get a better pain gating reaction. Not only that, but you're also getting down to the capillaries and the blood vessels in the area, and you're causing vasodilation locally. You can add heat and stim over the skin, and it's not going to get down, the 75 millimeters deep down to the facet where the pain is happening, but a needle can. So just a refresher for some of us, the gate theory of pain. In the dorsal horn on the upper left, you see the A delta and C fibers. Well, the A delta fibers from the mechanoreceptors within the muscle spindles, and yes, the dermis and the Merkel and the Meissners. That's when they all come to the synapse on the dorsal horn. The pain gating occurs at what's called lamina 2 or substantia gelatinosa of the dorsal horn, and that's a release of enkephalins, and that prevents the nociceptive input from reaching the cortex. And that's really how adjustments work, exercise works, stim, heat, everything we do, whether it's gua sha or grass, and these things all help with pain by causing a gating effect. But nothing adds as much gating effect as dry needling and some stim. You're getting right down next to the source of the pain. You're able to gate it locally. Not only that, but you're increasing circulation. Pain sensitivity is modulated by the concentration of pain modulators within the local circulation. So if you've got inflammation, you've got this soup of high concentration pro-inflammatory cytokines. When you stick a needle in there and you cause the vasodilation locally, and it washes out that high concentration with fresh blood and lowers the concentration of pro-inflammatory cytokines, that causes instantaneous relief. Yesterday, I had a patient, he's about a 9 out of 10 pain. He's got a pretty gnarly disc herniation. He's about 400 pounds, and he's just got into a car accident, and he's limping. And he hates needles, but he has lots of tattoos. It's always a quandary of mine how that happens. But I was able to convince him to let me do one needle just to see how it felt, so I could show him the positive outcome. But I knew it had to be right away, otherwise he wasn't going to go for it. So, and after I needled him, it was about 100 millimeter needle, because he's a big guy, down to his lamina. I was able to tap on the periosteum, increase that local circulation, and reduce the concentration of these cytokines. He got off the table and he goes, "There's no way you didn't inject something in me." And I said, "No, I didn't. It was just the needle in and out." And he couldn't believe how much better he felt, and we were able to get right into rehab right away. Now, there's not a lot of offices on the planet where you could do that, where you can needle the area, get local circulation changes, and then immediately go right into rehab. So, dose considerations. Now, how do we increase or reduce dose? Well, the needle's gauge is a big determinant of that. How round, what's the diameter of the needle? The thicker the gauge, the more painful the needle is. And so we don't necessarily always want thicker isn't always better, but the more stimulation you're going to get. And then obviously the number of needles, whether or not you do needle manipulation techniques such as periosteal pecking or fanning. And then do you want to add stim? If you're able to, when you put a stim pad on somebody, the hope is that that pain gating is getting down to the multifidus, down to the site of the pain, but really it's probably not. But if you can take a needle and drive and use it as a conduit to send that TENS current down locally to where the pain is actually occurring, right next to the DRG, you're going to get a much better response and a much better physiological response. You couple that with adjusting and some therapy, and man, you've got a powerhouse of very inexpensive intervention and very effective and very fast intervention for pain. Okay, so there's tons of studies on different types of conditions being treated with dry needling. Here's one where they compared just traditional PT with the addition of dry needling, found that dry needling provided for better outcomes.
All right. And we have a quick question here in the chat.
So please.
If dry needling provides more benefit versus superficial needling, then why does acupuncture require more training and hours compared to dry needling?
That is a great question. Thank you so much. Okay. So one, the evidence demonstrates that yes, it does provide better outcomes as far as pain, especially. But why does it require more training? Well, it doesn't. So we already went to school for, most of us 8 years before we go into dry needling. So it's dry needling training is after 8 years of school. And the most important part, which is the anatomy, going to acupuncture school, learning about the meridians and Eastern medicine and those topics, which I went through the chiropractic certification for. Those things, those aren't really necessary to do dry needling. What is necessary is a superior understanding of the neuromuscular system. And no one has a better education in that than chiropractors. They just don't, especially when it comes to the spine. I will do the Pepsi challenge any day with acupuncturists or PTs about who knows more about the anatomy of the spine and especially with bones and joints. So it's not that you only need very little training for dry needling, it's that you've already had it. Okay, you're just adding this additional technique to your wheelhouse of your education that you already have, would be the best answer.
Awesome. Thank you for that. And then just another quick question, are there
Mhm.
seminars around, and especially in Minnesota, to learn dry needling? We have somebody in our comments who's very interested. So can you shed a little bit of light on that?
Yeah, yeah. So I know a lot of states are as they get included with dry needling as it moves to different areas, they're trying to bring in people to teach these classes. Most of them are taught by physical therapists, and you can probably find one in your area if you go through your local association. Now, if you don't have one, or you would like us to come out there, it's really as simple as reaching out your association and we'd love to come out and start educating chiropractors in your area as long as it's obviously allowed. So yeah, definitely get with your association, find out who they're working with, and if they don't have anybody and they would like to bring us out, I would love to come to Minnesota, especially in the summer because I'm in Phoenix. So let's make that happen.
Awesome. Thank you.
Thank you. Okay, so another study on chronic headache, dry needling, again, better outcomes, better pain outcomes, reduce pain and doing it quicker. Another one on headache. Again, dry needling should be considered for the treatment of headache, and it may be applied alone or combination with pharmacology. I work in a multidisciplinary office. I'm very lucky. I get to have whatever I need at my disposal when I need it. So if somebody needs some anti-inflammatories before I do any work on them, we can do that. If they need an injection, if they need whatever they need, we do it all in house. And sometimes you do have to combine those things, but it's nice to have dry needling at your disposal to help those people right on the spot. Here's another study on disc herniation, similar outcomes. Here's another one on neck pain. I just want to show you that there's so much evidence out there for treating the things that chiropractors see walk through their doors every single day, that dry needling has evidence for helping them. And it's so inexpensive to add it to your practice relative to, if you have to buy a machine, it can only be applied to one person at one time and usually requires some sort of staff. Dry needling, it's 10 cents to a nickel per needle. The most expensive part is usually taking the class. It works very fast and it's very efficient. I love this study. I love this study because this study is for patellar femoral pain syndrome, or what we used to call quadrimalacia patella. And rather than treating it locally, if you remember, a lot of us were taught to rehab the VMO of the vastus medialis. In this study, they dry needled the glute med and QL muscles to stabilize the hip, which then fix the tracking problem, which then fixes the patellar problem. So not only is it a great dry needling study, but it's a great study in addressing the mechanics of an issue rather than the pain source itself. Osteoarthritis of the knee. These people have pain. How many of us have those patients that have osteoarthritis and are waiting for Medicare to kick in while they're suffering so that they can get their surgery? Well, in the meantime, in between, to give them some relief from day to day, dry needling, especially combined with periosteal pecking, really gives these people a lot of relief. It increases blood flow to the joint, which increases synovial fluid and lubricates the joint and reduces their pain. This is great, especially in winter months for those of you in cold areas like Minnesota. I'm sure you see a lot of this. This is a great study by some PTs, Dunning and Butts. Ray Butts is an excellent educator. I've had the privilege of going to some of his classes. But this is out of a group that teaches PTs adjusting and dry needling, because in their mind, they see the writing on the wall that reimbursements are going down. They go down every year. They always have. And so you better get real efficient, real effective, and real fast and real inexpensive. And so they're teaching their PTs, look, there's nothing better than adjustments and needles. And so if you do those things really well, you can do really well. And so that's what they're teaching out there. And chiropractors, I think, need to take heed that that's the sort of thing that's going on. Okay, so how does it reduce pain locally? Well, we just talked about the pain gate theory and reducing the concentration of things like substance P, calcitonin gene-related peptide, the pro-inflammatory cytokines. But over time, or with enough stimulation, you can get central mediation of pain via periaqueductal gray and Raphael Magnus in the brain with descending pain modulation. Basically, these nuclei within the brain have neurons that extend down to the dorsal horn all the way down the spinal cord, like every level on a skyscraper, and then shut down pain. It's that runner's high you feel, that full body kind of tingle thing. They call it the dasha in acupuncture, and that's the other way that it helps reduce pain. This is really the mechanism we're going for in our chronic pain sufferers. All right, so it also has effects on, we talked about blood flow, but we also know that by needling and increasing blood flow to the area, you can actually promote angiogenesis, or the creation of new capillaries. Here's an excellent study. I really love this one. This is where they're showing that there's a trigger point in the glute med, the pain or nociceptions causing vasoconstriction in the entire lower extremity. I can tell you, I've had this firsthand and it is extremely painful. But they also found that once they dry needled the patient, they're looking at the blood flow. They just dry needled the trigger point in the glute med, and they're able to change the circulation to the entire lower extremity. So it shows how not only is dry needling about the localized pain, but the general autonomic nervous system as far as the balance between sympathetic vasoconstrictive and parasympathetic tone. So let's talk about, are we qualified? Okay, so yes, there's been plenty of literature out there saying, especially from the acupuncture community, that we're not qualified. In fact, Dr. Amaro, which he just recently passed away, unfortunately, he was very vocal about whether or not PT should be able to be doing dry needling. He was my teacher for acupuncture, and he was a great asset to the profession. But he said, look, they just don't have the education, and they're danger to the public. But as we discussed before, every time you see an adverse event with a needling technique, the number one factor was the person just didn't know their anatomy, and no one knows anatomy of the musculoskeletal system better than PTs or chiropractors. And while acupuncturists do amazing work every day, and I have much respect for them, they just do not have the education we do when it comes to the musculoskeletal system. We don't. So if the argument is he who doesn't have the education shouldn't be able to do this, we're not going to be last on that list by any stretch of the imagination. Okay. In fact, in physical therapy alone, their program is 2,676 hours. So if you think about, a weekend class may be 24 hours or so. It's 24 hours on top of 2,676 hours. And you look at chiropractic curriculum. Now, unfortunately, I couldn't find a more recent update on this, but it gives you the idea of the number of hours and the topics discussed. If you look at the acupuncture hours and the topics discussed, Chinese medicine for 705 hours, it's really a noble theory. However, no one ever died because they didn't know where the fire meridian was. No one ever died because they didn't know where the sing points were. Okay, that education doesn't make people safer. What makes people safer needlers is whether or not you know the anatomy. Again, people go see acupuncture mostly for musculoskeletal pain, and we're the most qualified people to address this. Now, we actually do have CPT codes for dry needling. The ACA paired up with the APTA, so the PTs and the chiropractors got together, and they got us some codes. The way we're able to pacify the acupuncture community was that we said they could also use them. Now, why would they want to use our codes? Well, I have a theory. The reason being is because the code is not time-based. You can take it, it's based on how many muscles you needled. It's sort of like adjustments in that way, based on how many regions. So this is so you could literally, go in and needle someone's upper trapezius, and in and out takes, could be 10 seconds, and you've satisfied the code. Well, that comes in handy if you're an acupuncturist and you've had time-based codes where you have to satisfy amount of time. As we all know in our offices, time, in every hospital knows this, time is money. And so if you can do something quicker and cheaper and has the same efficacy, that is very valuable. And so these codes work really well for us, and probably is going to work well for them too. Now, does insurance cover these things? Most of the time, no, obviously not. But in personal injury, I do it all the time. That is my primary practice, is personal injury. I also consult doctors on personal injury. And dry needling is a great addition. One, lots of evidence. Two, doesn't take a lot of time. It's billable, and it also is complementary to the other pain management that they're getting usually. So let's talk about some cases as we wind up here. So this is a piriformis setup. Basically, what we've done is we've taken some needles, we've put them in the origins and insertions of the piriformis, being very careful not to hit the sciatic nerve. And we've actually used one needle there for what we call a depth check. It's that one that's sticking out the most. You're like, why is this needle sticking out like an antenna? Well, we use that to find the depth of the sacrum, and that tells us roughly the depth of then the piriformis. So that is a setup for piriformis syndrome or greater trochanteric pain syndrome. It works well for. And you can see the drawing on my students. They go home, their wives are always, or their spouses are always, what is all this drawing on your back? Because we really want to pay attention to our landmarks, because anatomy is the difference between doing this safely or not. This was a case of Bell's palsy. The man hadn't smiled in 2 years. And so, prior to this, I wouldn't have known how to treat this man, but I used my dry needling knowledge and education. And basically, we did about 5 sessions, and he was able to smile for the first time in 2 years, and that was very rewarding. It was one of those things where I've never treated somebody with this, but what were the options? There really weren't any, and he'd given up hope. And so when I told him, this is the first time I'd like to, this is what I'm thinking of doing. What do you think? He said yes. I said, all right. And we had a great outcome, and that was very rewarding. Something I probably wouldn't have been able to do without dry needling. It's another Bell's palsy case, because after that first one, I really was hungry for another one, and I was fortunate enough to have this lovely person walk into my office, and she hadn't been able to smile for 2 years. She couldn't drink out of she had to use like a sippy cup to drink, so she drool, and she had to tape her eyelid shut at night so she would be able to close her eyes so she could sleep. So I said, hey, would you do me a favor, take some pictures along the way, because I have a pretty good idea this might actually work. And so over time, she documented it a lot. And so she took a whole diary here of her improvement and how she was able to change, how her whole face changed. And for somebody that has to tape their eyeball shut every night for 2 years when you don't, that's something that is very rewarding to give back to them. Here we're the setup for chondromalacia patella, where we're placing the needles underneath the patella to increase the circulation in the synovium there. But really now, since that study that I read about the quadratus lumborum and the glute med, I find that if I start addressing that, immediately the pain starts to remit much faster than even addressing the patella directly. So this is the setup I don't necessarily do anymore, but it makes for a good picture. I treat, again, pretty much only car accident people and severe car accident people. And this was a contusion from the dashboard. We use needles to kind of break up the bruising around the shin there, and then used rock tape to continue the circulation, and then used cupping to draw the circulation up into the lymphatics and away from the area. And we got a great result within a very short amount of time. This one, this patient came in the upper left. He had bruising around his nipple there, and he had hit his chest relatively hard on the steering wheel. Now, he'd already been to the ER. He'd already been to pain management medical. And the pain wasn't that bad around his chest, but I said, you know what? we're going to order a sternum x-ray. I'd never ordered one before. It was the first and only time I'd done it. And lo and behold, I'm glad I did, because had I done an anterior on this man, I probably could have done more damage or any kind of thoracic adjusting, because you can see there in the x-ray, he has a fully fractured and displaced sternum there. So what are we going to do? We can't really adjust this person. He's got a fractured sternum. Well, when you have dry needling, the nice thing is it allows you to start treating people who are in pain or have injuries who maybe any kind of other physical intervention wouldn't be appropriate. Here's another one. I believe this person had a full laminectomy in the lumbar spine with fusion. We were able to needle. I was able to look up his MRI to find the depth of his muscles and the aquatic quina, so that I didn't go down that deep. And we used the appropriate needle length and then stim. So we're able to get mechanoreception into an area that you can't move. And that is pretty neat stuff, and really helped us get him some relief that otherwise I don't believe I would have been able to. Here's another example. Now, those needles go all the way down to the lamina. They're down to the bone. So when you see that contraction, you're getting localized circulation pumping with the multifidus, which makes up the posterior 50% of the facet joint, and gets all that inflammatory cytokines out of there, and helps get those people relief. Nothing is going to get that deep except for the adjustment, but definitely not stim pads or heat. If you don't believe me, go and get some stim pads, put them on about 3-inch stakes, and then see how much you have to crank that thing up before you feel it under, with your hand at the bottom, or put some heat on it. It's not getting down that deep. Laser isn't either, but this is. Again, these are my students doing their piriformis setups for the first time. Really nice work here. We're doing low frequency stim and getting that piriformis to pump that in and out, fatigue it out, and then it's much easier to adjust and stretch. Really nice work there. I want to show you this. This is our schedule coming up. I teach predominantly in Texas and Arizona, but I would love to come to whatever state and teach more chiropractors. I love teaching chiropractors how to do this. It is the most fun class ever, because you're doing things with your hands. This isn't one of those things where it's someone, just you're listening to them lecture the whole time like this. I don't usually talk this fast, but I know you guys are getting back to lunch, because I know what it's like to be in full time practice. But most of it's hands-on. It's like your old class technique class. You're actually learning a new skill, a new art, and it's wildly rewarding. And now I know I was supposed to show you how to do notes. I'm gonna do that really quick because really ChiroTouch is the best. I mean, none of us like doing notes. Let's just be honest. None of us like doing notes. I've never heard a chiropractor once say, I cannot wait till the end of the day. Instead of going home to my wife and kids or my spouse and my family, I would rather do notes. Never, never, never. Everyone lets them stack up and then your staff is bugging you to get them done. But ChiroTouch makes that process so much easier and more convenient. And I just love their interface, especially with the cloud. But here's my dry needling note. So what I did is I made this macro so that when you click on the body part, just like you do on the pain scale, it picks a muscle or a nerve in the area. That's typical. So let's do a real easy one. Left upper trapezius, bam. Okay, gonna hit save. That's what we did. We needled that. I took the note of what my nurse practitioners use when they do trigger point injections, which talks about the gauge of the needle, the alcohol prep, and the informed consent. That's all in there already. We put the needle location. This one, now this in the upper trapezius, I typically don't leave in for 15 minutes. I usually go in and out. So that's note is going to be changed. And then whether or not they felt better, they tolerate it well. And then what was the effect? Well, the goal here is reduce pain and increase range of motion. That's my goal every visit. Get there as fast as possible. Usually it goes like this. Where do you hurt? Great. We're going to needle the muscle, adjust the joint. So now we got the bones and the meat taken care of. We're going to reinforce that with some exercise, and I'll see you in 2 to 3 days. That is a highly effective visit. It's really fast. And if you know anything about people nowadays, they don't even want to be bothered to go grocery shopping. They have it all delivered. So taking another trip to the chiropractor is not on their to-do list. So if you can be fast and efficient and effective, then that's the way to be. And that's what dry needling allows you to do. And ChiroTouch allows you to make your note and really make that, again, add to that efficiency and time. Just getting it, again, time is money and time is valuable. And so if you don't have to waste it doing notes, then really ChiroTouch can help you reduce that pain. So I highly recommend using their cloud. If you haven't switched over, I would do it now. Just cloud-based is the future, and the longer you wait, it's the harder it's going to be. So in the name of modernity, everyone switch to the cloud, please. And it allows us to trade macros like this. I'm able to give you this macro because of the cloud. And really, I want to thank Sawyer and the whole team and Anna and everybody over at ChiroTouch for inviting me to come over and do this. I hope it was informative for you and you got something out of it. And if you can't attend one of my classes, please find one in your area. And if you don't have one or you want me to come to your area, I would love to hop on a plane and come to wherever you are and teach dry needling to you guys. So thank you so much. Sawyer, it's all yours.
Awesome. I'm going to pass things over to Anna really quick to just kind of show you guys what all else this looks like within the ChiroTouch interface. So Anna, over to you.
Yes, perfect. Very good. First of all, I want to thank you, Dr. Aaron. That was amazing. One of the things that I love about working with chiropractors is that you guys help people in such a beautiful way. So thank you for sharing all that knowledge with us. I also love that chiropractors are willing to share their knowledge with others, and we are excited that he is sharing his macro sets with us. And I'm going to talk to you guys a little bit about how you can implement that in your office. If you know this already about ChiroTouch is the most intuitive, super easy to use software. It's a single platform with unmatched EHR, billing, compliance, patient engagement solution. And like Dr. Aaron was saying, we are now 100% cloud-based, which is super exciting. It gives you the freedom and the flexibility to access your practice from any device, from anywhere in the world, anytime. Also, you don't have to have a server or any system requirements. You could use any type of device. And then, of course, no backups are needed because we are backing it up for you. And it is a much more modern, beautiful platform. We navigate over on the left-hand side, and some of the key components that we bring into our cloud are scheduler that helps you also manage your flow of patients for the day. So your front desk can easily manage everybody that has an appointment today and move them over to check-in and check-out. It helps them manage all of that flow. You'll be able to kind of keep all of your patient information in one hub. And of course, our amazing billing platform as well that integrates with any clearinghouse to allow you to submit claims directly from here. So those are some of the kind of loved features of ChiroTouch. And of course, the main one that we're going to focus on today is charting. And in charting is where you saw Dr. Aaron earlier load those macros. And in our charting screen, our provider all-in-one screen is where you will be able to do all of your notes and diagnosis and all of that fun stuff. But what I want to talk to you about to kind of complement what Dr. Aaron was sharing is that in ChiroTouch, you can do all of the charting that you need for dry needling. I love what you said. Like we know, nobody absolutely loves to sit down and do charting, but he has made it a lot easier for us by providing us the macros that you will need to do the charting. Now, if you did a thumbs up, and if you haven't done that, you can go ahead and do it now. If you give us a thumbs up, we will be sending you the macros that Dr. Aaron is sharing with us. And what you will do is you will get a link. You're going to click on that link from your email, and it will automatically drop his macro set to your downloads, okay? So then you're gonna go into your settings. At the very bottom left-hand corner, you're gonna go to settings. So I'm gonna click on that so that you can see where you're gonna go. Then you're gonna go to practice settings, and then you're going to go to macro sets right here. And then we're gonna come up here to this awesome tool called import macro sets. You're gonna click on that. Then you're going to hit select a file. And the download is going to automatically be under your download. So you're going to find it there, and it's called master. You're going to grab that and just simply hit open. Once you do that, in a few seconds, you're going to see that drop right into your list of macros that are now available. Now remember that ChiroTouch automatically comes with routine, bullet touch routine, evaluation, cash, and also personal injury macro sets. These are the macro sets that are already there for you. But once you do that, you will now have Dr. Aaron's macros on here. So one more time, we're going to go to settings, practice settings, macro sets. You'll hit import macro sets, select a file. You'll be able to grab that file, which should be found automatically in your downloads once you click on that link that we will send to you, and that will load for you here. Now, since we're on the topic of macros, I want to also let you know that you can from here customize any of the macros, either the ones that we have already on here, or if you like Dr. Aaron's and want to customize them a little bit, you can grab the macro set from here and hit copy macro set, and it will open it up for you in a customizable format where you can come in here and make any changes to those macros. You can also do that with any of our macros that come preloaded in your system. So you can customize, you can change, edit, remove any of the macro sets by simply hitting the three dots, hitting copy macro set. You can make it your own by giving it your own name at the top here, and then you'll be able to customize, add macros in here, text button, menu buttons. You can get really fancy and add macro sets with different multiple choice options or even images, which is how Dr. Aaron was also able to create those macros. But just wanted to give you some background on that. And once you have uploaded the macros, we're going to go back over here to charting. We'll grab our patient here, Michelle. We'll open up chart notes here, and then you will find that macro set loaded right here where you have your different macro sets. The one that Dr. Aaron is sharing with us is called master, and it will be right in your list of macros. So your current macro sets that come with ChiroTouch will be right here. So you've got your routine, evaluation, quick cash note, personal injury, which by the way, quick parentheses, if you don't have ChiroTouch, just to let you know, it already comes with these 4 preloaded macros that are compliant, ready to use, super easy to use. And also you can, of course, make any changes, and then you will also have Dr. Aaron's as well. So you will have that here. When you have loaded your macro set, you're going to navigate on the top section here, S, O, A, and P. One thing that I like to say about using macros in ChiroTouch is I like to think of these buttons here in the middle as building blocks. you're going to select from the building blocks in the middle to help you build the text at the bottom. And each section at the top, S, O, A, and P, has its building blocks right up here to help you build your text at the bottom. So you don't have to click through all of them. You just have to click on the ones that you need to build your text at the bottom. So kind of like the example he shared earlier, if I'm under the master set here and I'm under plan, I can then select the button that I need here, go through, answer the questions, and it will drop the text here at the bottom for me. Anything that you see in blue like this, those are hyperlinks. That means that you're able to click or touch those areas to make any changes. So we're able to come in here and click and make any changes. Our hyperlinks work really well when our notes are salting. For us, salt means same as last time. So I'm going to give you one quick example here. If I'm under charting and I have a list here of patients that are currently in the office and Miss Lily has been here before, and I go to chart note here, if I click on her soap, the system automatically repeats her visit from the last time. And all I would have to do is quickly just make changes to what is different today. So that's what that salt means. Same as last time, repeats everything for you. And then you're just simply able to make those changes on those blue hyperlinks. So that is one powerful feature of ChiroTouch as well, that it allows you to repeat that note and make any changes by just simply clicking or touching those blue areas there of the note. If you have any questions whatsoever about our macro sets, or you want to learn more about ChiroTouch, please let us know. Sawyer is about to give you a way that you can let us know to help you and show you more about ChiroTouch. But thank you so much for the opportunity to share a little bit of ChiroTouch with you today. Back to you, Sawyer.
Awesome. And thank you so much for that, Anna. I feel like my eyes are like wide open, learning all of this new information. Like you said, super intuitive, user-friendly. And Dr. Wiegand, thank you for sharing, your notes with all of us. I know that we all,
Yes.
are really looking forward to being able to utilize those in our practices. And the way that you've shared them is so easy to just pull over into the ChiroTouch interface. So again, just really appreciating that. I do want to take a moment. We did have a question here in the chat. Dr. Wiegand, this one's going to be for you. Do you bill the stim separate from the needling, or is it included?
Oh, that's a great question. So as some of you may know, with acupuncture, if you do acupuncture with stim, it's a bundled code, which is obviously has its own drawbacks. However, with dry needling, they are two separate things. So when I perform dry needling with stim, I bill them separately. So we have one code we use for the dry needling and another code we use for the stim. So that gets us our first two codes right there.
I do have a question that says, I'm interested in taking the course. Did you say you're giving a discount code? Dr. Wiegand, do you want to speak on that?
Yeah, so all of you should be receiving a discount code for $100 off your first class.
Yes. So everybody who has attended today will be receiving a link once we finish up here in just a minute. Within that sort of post-webinar email, you'll have a link that has not only Dr. Wiegand's custom macros, but also a direct link to his website and a special coupon code that you'll enter at checkout once you go and check out his website. So we're going to have all of that sort of wrapped in the recording, the macros, and the discount code as well. So just keep your eyes peeled on your email address. If for whatever reason you don't receive that, you can reach out to me directly. My email is sbarcus. It's SBARCUS at ChiroTouch.com. That's my personal email address. So again, sbarcus, BARCUS at ChiroTouch.com. Again, we really appreciate the time that everyone's taken today to sit down with us and learn more about what dry needling is and what it can look like in your practice.
Thank you guys so much for having me. I appreciate it.